Mr. Speaker, in 2011, the government gave a $100 million untendered 10-year contract to an Alberta company, the STARS Helicopter Service. The normal limit for contracts above which they should be tendered is $25,000 for goods and $100,000 for services. The contract to STARS was for 1,000 times more than the normal maximum size for untendered contracts for services. I asked the Premier, what was he thinking when he and his government gave a $100 million untendered contract to Alberta's STARS Helicopter Service?
Yeah, thank you, Mr. Speaker. What we were thinking is that Manitobans deserve to have continuity of service. The STARS helicopter program had served us well in the flood of 2009. It had served us well in the flood of 2011, and an expectation had been generated in the public that that service would be continuously available to Manitobans, particularly during challenging times of events like floods or other disasters or situations where people could not be reached by land. So the project was continued, the STARS project was continued, and it has provided continuity of service. And when errors have been identified or problems have been identified by medical professionals, we have listened to them, we've let the medical professionals deal with that, and when medical professionals have said it's ready for that service to be put back into action, that is when it has occurred, Mr. Speaker.
Mr. Speaker, the Auditor General has found that the government's action in giving an untendered contract to STARS did not comply with provincial tendering principles, practices, and legislation. I ask the Premier, why did he disregard normal business practices and provincial laws and hand a lucrative, untendered contract to a company in another province rather than opening up this contract to competition from excellent Manitoba businesses?
It was determined that continuity of service was fundamentally important to serve the needs of Manitobans. To put it out to tender would have taken 18 to 24 months to reboot a service, potentially under another provider. We wanted continuity of service. That continuity of service had served us very well in 9, had served us very well in 11, and there was a desire to continue to provide that service based on the successful performance of STARS in 9 and in 11. And that was the rationale behind it, to make sure Manitobans had emergency service when they needed it, particularly in difficult circumstances or in situations where land service was not able to reach people. That was the priority, was to protect the health and well-being of Manitobans, Mr. Speaker, rather than have a gap in service which would have left Manitobans vulnerable during very critical times in their healthcare cycle, Mr. Speaker.
Mr. Speaker, the Auditor General has revealed that the full cost is likely to be $159 million, and not just $100 million. The Auditor General has also revealed that the costs per mission in Manitoba were likely to be 231% or 618% higher than in other provinces. I ask the Premier, does he not, as others do, consider untendered contracts as unfair business practices? I ask the Premier, how does giving away enormous untendered contracts to non-Manitoba businesses benefit Manitobans?
Mr. Speaker, I've put on the record the rationale for continuing service, to provide continuous service to Manitobans, to ensure that at a critical time in their lives, when their lives are at risk or their health is at risk, the service would be available. Mr. Speaker, we want as few incidents like that as possible, and Manitoba has worked very hard to reduce the number of emergency situations when people would need that service. We've done that in a variety of ways. We've made very significant investments in nurses, very significant investments in doctors, very significant investments in new hospitals and personal care homes, and very significant investments in healthy living in the province of Manitoba and addressing chronic disease issues. So the less incidents we have, the less we will need the service. But where the service is needed, it is available. And that is the point, is to ensure the service is available on a continuous basis when Manitobans need it from a provider that had a good record of providing that service, not only in Manitoba in 09 and in 11, but a good record of providing that service both in Saskatchewan and Alberta as well, Mr. Speaker.